UroPatient. Tune in and see, empowering your health for you and me, you and me. Knowledge is power, we make it clear every Saturday morning. The podcast is here.
All right, so if your doctor has recommended a prostate MRI, you're likely to have questions about what to expect. Today, I'm walking you step by step through exactly what you need to know, from how to prepare, to what happens inside the scanner, to understanding your final results. Now, usually I explain most of these tests from the perspective of a nurse, but this time I actually was the patient, so I'm here to tell my story. First, what exactly is this test? A prostate MRI is a non-invasive imaging scan that uses a powerful magnetic field and radio waves to provide highly detailed three-dimensional views of your prostate gland. Now, here's the key. Unlike X-rays or CAT scans, this procedure is completely safe as it doesn't use any ionizing radiation. I'm starting to get more worried about all these CAT scans and things that have a lot of radiation behind them, but MRI doesn't. Now, many people think that an MRI replaces a biopsy. Not exactly. An MRI helps doctors locate suspicious areas. A biopsy collects the actual tissue samples to determine whether cancer is actually present. Now, the MRI often helps physicians perform a much more targeted biopsy, which means fewer unnecessary needle samples, and, this is the big key, a better detection of significant prostate cancer. So this should be part of your routine and your step before you have a biopsy. Now, you may hear your doctor mention something called multiparametric MRI. What is that? So that's what they use for this. Think of it like looking through three different camera lenses. The one looks at the anatomy, another one evaluates blood flow, and then finally another measures how water molecules move through the tissue. Together, they put these all together, and these different views help radiologists identify areas that deserve a closer look. Now, here's the big stuff you'll probably want to know about: preparation. It begins sometimes a couple days before your appointment. Your healthcare team will recommend dietary changes, possibly things like avoiding ejaculation before the scan, and following specific instructions regarding bowel preparation. Always follow the prep instructions provided by your imaging center because they know what works best for their machines. Now, by the way, the instructions that I received from my MRI was that I couldn't eat or drink for 4 hours prior to the test. And I had to give myself a Dulcolax suppository about 2 to 3 hours before the test. Now, I had an early morning appointment, so not having anything to eat or drink was really not a big deal. And I put in plenty of suppositories to other people, so I could do it myself. And it's not the end of the world. It's a little discomfort, but really nothing. And here's the key. I've had colonoscopies. This doesn't cause that massive blowout like the prep for a colonoscopy. It merely makes you feel like moving your bowels, or makes you move your bowels in about 30 minutes. No cramping, and here's key, no worry that I wasn't going to be able to control my bowels for the test. That's a biggie. Now, many centers can recommend things like a low residue or low fiber diet before the MRI. Foods like chicken, fish, rice, and potatoes are generally good choices. Foods that create extra gas like beans, broccoli, or carbonated beverages, you probably should limit those. Now, these recommendations help improve image quality because gas can sometimes interfere with the MRI's vision. Now, I didn't have any special dietary instructions from my center. And, by the way, my diet tends to be more like the one on the left anyway, so I was fine. One thing patients rarely hear about is swallowed air. Too much air in the intestines can sometimes reduce image quality. Eating slowly, avoiding chewing gum, limiting carbonated beverages beforehand, all these things can help reduce excess gas. Small details like this can actually improve the quality of your imaging at the MRI. Again, for me, not a big issue because I'm not a big pop drinker. Mostly, I like water. Now, hey, keep in mind, the MRI uses a powerful magnet. I'm talking superpower. So anything that can be attracted by a magnet's absolutely out. You don't want that. So for my own prep, I left my jewelry at home, my rings and my chain, and I left my wallet with the credit cards, and I left my watch off. Now, I found out when I got there, and many of the centers that I've been to before have a safe that you can put your stuff in and they lock it. So it's probably could have brought all that stuff anyway, but why not? Be safe. Now, the only thing I did goof up on is I had a pair of pants that I didn't realize had a zipper on it that was metal. So I had to wear a gown. No big deal. Also, it's important to let them know if you have any cardiac pacemaker, defibrillator, implants, anything that could contain metal that couldn't be seen, such as plates and things like that. Now, when you get there, you're going to fill out a question form. It's going to ask you all the questions about every possibility that could possibly be metal inside of you. So they're pretty thorough about that. Now, when you arrive, you'll change into a gown. Sometimes. Actually, had I worn my shorts that have no metal on them, I could have just kept those on. But the big thing is they want to make sure you have no metal objects. And they're going to start an IV if contrast is needed. Most of these MRIs do require contrast, so you can count on getting that IV started. Now, nobody likes getting stuck with a needle, but I've had plenty of needle sticks. It was no big deal. Some patients could receive medication to help reduce bowel movements during the scan. Totally unnecessary. Like I said, I had no issues with feeling like I couldn't control my bowels after that Dulcolax suppository. But your prep may vary, and if you have issues, be sure to mention it. Your MRI technologist should explain everything before the exam begins. Mine was great. Here's a little known fact. I remember from many years of working in urology that the early MRIs, like the 1990s and 2000, centers performed this MRI by inserting a specialized endorectal coil into the rectum. Now, that wasn't too comfortable. Bearable, but not comfortable. This is definitely a question I would ask if you're going to have an MRI done. Do you use an endorectal coil or the pelvic coil? As you can see from this picture over here, that's what they used at my MRI. No big deal, just like wearing like a wrestling belt, that big belt that they wear when they win the match. So I guess I won. Now, during the MRI, you're going to have to lie very still on the scanner table. That's key. You can't be moving around. You're going to hear loud knocking sounds. That's perfectly normal. It's going to sound like construction around you. They always give you ear protection, so you either get earplugs or they offered me music, so I put some country and western on. And you're going to be able to communicate throughout the procedure with your technologist. Not a big deal. They gave me a little hand thing, a ball that you could squeeze if there was any need that I had to contact them to talk to them. Never did. One of the things now, I told you several MRIs in the past, so I'm pretty familiar with that noise and all that stuff. But they've been my back, which meant my head was in there. So if you're claustrophobic, sometimes that can be a little bit scary when you're in that MRI. I'm not claustrophobic, so it doesn't bother me. But I'm going to tell you, for the MRI of your prostate, you're going to be all the way through that tube so your head actually can see out the other end. So if you're claustrophobic, don't worry. You're going to be able to still see. So just a little pointer. Now, I told you that it's noisy and they give you some sound and stuff, headphones to put on. I got to tell you the truth. I just fall asleep during the procedure. It's a 45-minute procedure. Good time to get a nap, right? Now, the good news is there's like nothing to the recovery. They take out your IV. If you get dressed, you get dressed, and you're out. Now, here's the key, though. If they use contrast, make sure you drink plenty of fluids. That's important. You want to wash that out of your system. Even though it's not really bad on your kidneys, the newer stuff is, especially the new contrast that they use, is much easier. Still should be washed out of your system. Best to do that. I ran over to Dunkin' Donuts, got a large coffee to get it flushed right away, and then finished up all day long with drinking water. Told you I like water. So, I said, no sense not taking precautions. Now, if you were given sedation, you will need someone to drive you home. Again, everybody's different. So if you're one of these persons that's super nervous, you don't think you're going to be able to hold still, ask them if they can give you sedation. Sometimes a little pill that can relax you is all it takes. I can tell you personally, going through it, you don't need sedation. This thing is a piece of cake. Now, your MRI is interpreted by a radiologist. That's a physician specially trained to analyze medical images. The radiologist is going to prepare a detailed report, which will be reviewed by your urologist, who then combines those findings with your PSA, medical history, and their physical exam. They put all this stuff together to try to come up with a conclusion. Now, here's how it's read. MRI findings are commonly reported using what they call the PIRAD scoring system. It scores your prostate, if they see a nodule, from 1 to 5. The lower the number suggests cancer is unlikely, so you want to have a 1 or 2. 1 or 2 they can watch. 3 is kind of like that, you're right in between. I would say in today, with MRIs, you could probably just watch it with another MRI down the line if it's a 3. Now, when you get up to the 4 and 5 mark, those are the ones that have a higher risk of being cancer. Significant cancer, that's important. We don't want to get this nicky-nack stuff that you really shouldn't have to treat anyway. But if you're up in that 4 or 5, you're probably going to be going on to a biopsy. Now, does that mean you have cancer because you got a 4 or 5? Absolutely not. I've read through many reports about the MRIs and what the scores mean, etc. And there are other things that cause those PIRAD scores to go and become elevated that are non-cancerous. So don't panic. It's not time to panic yet, but you're going to probably go on to what's called an MRI-guided biopsy of your prostate. Now, your physician will sometimes order additional tests or urine test or targeted biopsy. All that depends on what that MRI score is, so keep that in mind. This is a way to personalize your care, and most importantly, for many of us, it's going to help you avoid an unnecessary procedure. If you don't have to have a biopsy, I think it's a better way to go. Now, when you meet your healthcare provider, when you see your friendly urologist, you should have some questions you're going to want to make sure you ask. Ask what your PIRAD score is and tell them to explain what that means. Why they would want any additional testing. It's your body. You should know what's going on. And what treatments, if any, should be considered. What's the advantages, disadvantages, if you wait. Good news with prostate cancer is you got time. Make an informed decision. Something you feel confident about with your healthcare worker. So, what did my results show? Well, you're going to have to tune in to find out in a future UroPatient. I'm Vic Senese. Thanks for joining me. If you found today's episode helpful, please like this video, subscribe to the channel, and share it with someone preparing for a prostate MRI. Now, next week on UroPatient.
Is tamsulosin or Flomax really the best medication for an enlarged prostate? In this episode of UroPatient, host Vic Senese explains how tamsulosin works, who benefits the most, common side effects, and when another treatment may be a better choice. If you're experiencing frequent urination, a weak urine stream, difficulty starting urination, getting up multiple times at night, or incomplete bladder emptying, you've probably heard about tamsulosin. But is it the right medication for you? Join us on August 15th at 10:30 a.m. Central Time to learn more.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side.